So the point of Dr. Voll available on the border of bone means where the bone is starting and bone ending. So there is a little depression, and where we are having the point of Dr. Voll, right? So let's see in this image, if we talk about the lymph meridian. So we can see the points available on the upper border or the lower border of the bone. We can see the upper border and the lower border also in the middle. So this is just example of the lymph meridian. This is the one another image of the lymph meridian. The points available on the border of bone. Let's see the lung meridian. The lung meridian also having points on the border of bone. Sometimes it's on the upper border. Suppose this is the bone. This is the bone, right? So the point of Dr. Voll mainly available on the upper border and the lower border, but sometimes also we can see in the middle border, right? But it will be definitely available on the border of bone, and we are exactly pressing the bone and feeling the pain here, and we want to treat this point. We will be stimulating the side area of the bone and we can treat the disease. So this is the lung meridian. So we can see in the Dr. Voll system, the lymph meridian is passing from the outer side and the lung meridian passing from the inside. Okay. So the outer side meridian is the lymph meridian and the inner side meridian is the lung meridian. Now, if you want to treat any lung disease, you will be working here. So then we have seen this is the large intestine meridian. Okay. The large intestine meridian is passing from here, and this is the same meridian like we are seeing in the traditional acupuncture. In the traditional acupuncture, this is the location of large intestine 1. This is the location of large intestine 2. Then the large intestine 3, large intestine 4. We can see the multiple points, and they are the same point like given in the TCM. But when we talk about the Dr. Voll definitely has given the same point, but in between them, they have done more research, then they have given few more points like we can see. So these are the extra points given by the Dr. Voll and all the points available on the border of bone, which given by the Dr. Voll. The other point given in the TCM has been taken by the Dr. Voll as the points are, and Dr. Voll has introduced their point on the border bone. So this is the large intestine meridian. Let's see this one. This is the nerve degeneration meridian, and with the help of this, we can treat the problem of the nerves, whether the problem of the brain, the problem of the meninges, the problem of the nerve of the arm, or the nerve of the leg, the nerve of anywhere in the body, we can treat with the help of this nerve degeneration meridian. So we can see ND 1, 2, 3, 4 in that way. There are multiple points here. So ND1 here we can see like we are having detailed discussion. ND2 here, ND3 here, ND4 here. Actually, Dr. Voll has given these points first, ND1, ND2, ND3, ND4. Then after doing more and more research, he found more points. Now what the name, then how can give the change the nomenclature? Then they have given the name like ND1A, like ND1V, so ND1A, ND1V. So in that way, he has given A, B, C point, like 1A, 1V, 1C in that way, right? So these are the nomenclature given by Dr. Voll. So this is the nerve degeneration meridian. So in the index finger, on one side we are having large intestine meridian, which is exactly the same given in the TCM. And in the inner side we are having nerve degeneration meridian, which is the new meridian given by Dr. Voll. Then we are coming to the pericardium meridian. So this is the pericardium meridian, and there is no difficulty with this because we already know as per the TCM, this is the pericardium meridian. Any problems? Am I audible clearly? Participants are calling me, that's why I'm asking. Am I audible? Perfectly all right? Okay. So this is the traditional meridian. We already know this. This is the pericardium. Okay, pericardium meridian. So pericardium meridian going from the one side of the middle finger. Okay. And because there is no question whether it's going from the dorsal side or from the ventral side, these meridians are neither going from the dorsal side nor from the ventral side. These meridians passing from the border bone. If I tell you, tell me the location of pericardium meridian. Then I will tell the pericardium meridian is passing from here, right? This is the pericardium meridian passing from the border of bone. Then here also, it's passing on the border of bone, whether you want to reach from here or you want to reach from here, because this is just on the border of bone. So we can reach from here or we can reach from here, right? The most like common thing, like in the TCM, we are reaching from this side. If I turn my middle finger, so this is the location of pericardium 8. Okay, pericardium 8. If I turn my middle finger, so what I'm going to tell you, the pericardium meridian is passing from here, and this is given as per the TCM, and it is passing on the border of bone. Okay. Yeah, so we can tell like this is the front part of the bone, and on the back side, this is the back part of the bone, but the meridian neither on the front part nor on the back part. This is on the border of bone, on the sides, on the side. But if we want to put the point, if we want to do the electric stimulation, suppose I want to stimulate certain point with the device, then I can stimulate like this. Okay. I can stimulate like that, or I can put the seeds in that way. Because so we can stimulate the point from both the side. But the most common side, we have to stimulate the point from here. Now, pericardium meridian has been given another name as per the Dr. Voll. Dr. Voll has given the new name, that is circulation meridian. So wherever you see the Dr. Voll pericardium meridian, he has given circulation meridian, and you will find CI. CI means circulation meridian. The meaning of CI means pericardium, right? So pericardium and circulation are same. So pericardium meridian is passing from this side, right? This is the side of the pericardium meridian passing from this side. So this side is empty. In the traditional acupuncture, we don't have anything here. But as per the Dr. Voll, these sites are very much important. So let's see, as per the Dr. Voll, these are the sites of allergy degeneration meridian. So allergy degeneration meridian passing from here. And what is the meaning of allergy? I will tell you shortly. For example, suppose someone is suffering with the diabetes. Someone is suffering with the diabetes. So as per the Dr. Voll, the diabetes might be causing because of the allergy in the lower barmer. Okay, so we will be using allergy point for the diabetes. Suppose someone is having itching in the genital part, that is also allergy. Someone eating certain types of the food, and because of that food getting the rheumatoid arthritis. Many person are eating, drinking the milk or eating the wheat, and after that they are suffering with the joint pain. So as per the Dr. Voll, this is the allergy. So we cannot forget the allergy meridian. So allergy meridian, without the allergy meridian, even you are not, you will not able to treat the diabetes. Dr. Boll has given only 4 points for diabetes, and Dr. Boll has told just by 4 points you can treat the diabetes very successfully in most of the cases. And 1 point will be allergy point, that is AD1, we'll be discussing shortly. AD1, that is called allergy degeneration point, that is the point of lower bar, lower part. So any allergy in the lower part, it's not only the diabetes, anything which is happening in the lower part, we can use AD1. AD1 is the wonderful point for allergy. Okay, it's a wonderful point. It's given by the Dr. Boll. So allergy meridian, when we talk about the allergy, we just think, oh, maybe skin allergy, maybe gluten allergy, maybe pollen allergies, maybe allergic asthma, maybe allergic running nose. No. Okay, these all are allergy for sure. So we will be using allergy meridian for all types of the allergy, but we also using this allergy meridian for many complicated diseases like the diabetes. Okay, so we will be discussing that. So as per the Dr. Boll, the pericardium meridian on the one side and allergy meridian on the other side. This finger is very important finger in the gorilla image. In the gorilla image, this finger is doing the representation of the brain. Okay, in the gorilla image, gorilla is walking like that. Okay, gorilla, these are the legs of the gorilla. So in the gorilla image, these are the legs. So this middle finger is very important finger, you know. What is allergy? The meaning of allergy, when you are eating something, like suppose you are drinking the milk, but brain is reacting and secreting the antibodies, then there is a fight between the milk and the antibodies. So this is called allergic reactions. Okay. What is allergy in the sinus allergy? Suppose some dust particles going in the nostrils, then your brain is reacting against that and creating some eosinophils or the WBC. WBC are the policemen of blood. So WBC are fighting with the dust particles. So there is a dust particles and the WBC are fighting together. So this is called allergy. So what is allergy? Allergy means when brain think, oh, this is something wrong. So brain is fighting, brain is secreting something, brain is sending the WBC to fight. So brain is connected with the allergy. So this finger is having brain meridian, means pericardium meridian, as well as the allergy meridian, right? On the one side, we are having pericardium meridian. On the other side, we are having allergy meridian. Now this allergy meridian, one of the great meridian, and with the help of this, we will able to treat diabetes. And diabetes is very challenging disease. So we'll be discussing. Okay. So let's see all the other meridian quickly. Yeah. So we have seen this is the allergy meridian. Then now this is the meridian. Now we are talking about the ring finger. Ring finger is a really very important finger. Ring finger. Ring finger is connected with our youthfulness. That's why the during the marriage, the couples are wearing the marriage ring in the ring finger. Because ring finger is connected with the youthfulness, vitality, your reproductive capability, your aging, your youthfulness of the each and every organ of the human body. So on the one side, we already have triple bottom meridian in the traditional acupuncture, in the TCM. The one side, we already have triple bottom meridian. The triple bottom meridian is a very important meridian. On the other side, which is empty, because in the traditional medicine, there is no any meridian passing from this side, but as per the Dr. Boll, this is the meridian that is called organ degeneration meridian. Organ degeneration meridian is one of the very important meridian because with the age our organ are getting degenerated, right? So by stimulating this, we can strengthen the organ and we can bring the vitality and youthfulness once again. So this organ degeneration meridian will be very helpful, and with the help of this, we will able to treat very deeper level diseases. Even we will able to treat the disease like the cancer, right? So the organ degeneration meridian will be doing very deeper cleansing. Suppose we are cleaning our home every day, but during the Diwali or season, we are cleansing home very properly. We are removing, we are coloring the home, and we are cleaning the home very properly. In the same way, in the human body, there are two meridian. They are responsible for cleansing. Number one, lymph meridian, lymphatic system, which is cleansing the system. Number two, this organ degeneration meridian, this is doing the cleansing from the very deeper level. Okay. So this organ degeneration meridian is found in our ring finger. Remember. So in the ring finger, we are having two meridian. Number one, organ degeneration, and number two, triple warmer. So we can see here, this is the OR1. The name of this point is OR1. We can see here, right? And this is the OR2, organ degeneration number 2. Then the OR3, 4 like that. Then after some time, Dr. Voll has found many other points. So he has given the name like the OR1A, 1V, 1C, 1D like that, right? 1C, 1D. So these are the points found in between. Each and every points are very wonderful, and we will be treating these points in the very deeper level of the disease. We will be discussing them. So after that, let's see the triple borough meridian. We are already very well aware with the triple borough meridian. The other name of the triple borough meridian is also endocrine meridian. Endocrine meridian. So if we are having any types of the endocrine dysfunctions, I'm taking the very common example, like if someone is suffering with a thyroid disease, there's the endocrine dysfunction. Someone is suffering with a diabetes, this is also the endocrine dysfunction. So we are taking the help of triple borough meridian or the endocrine meridian. So we will be seeing the triple borough meridian points are very wonderful. And when we are making the protocol of the diabetes, we are taking the point of the triple borough. Okay, so remember, we are going to discuss the point found on the triple borough meridian for the diabetes. And I told you there are only 4 points given by the Dr. Voll for the diabetes, and we can treat the diabetes successfully. So 1 point found in this endocrine meridian, and definitely without the endocrine meridian, how can we think and how can we treat the diabetes? Okay. So let's see here. These are our already familiar meridian. We are very well aware. The name of this meridian is heart meridian, right? So this is the heart meridian found. Even we have discussed this meridian, the TCM. It is the same meridian. There is no change. But Dr. Voll has taken few more points in the path, right? So we can see in this image, like as per the TCM, we know this is the heart 7. This is the location of heart 7. Okay. And as per the Dr. Voll, this is the heart 8. But as per the TCM, this is not the location of heart 8. But as per the Dr. Voll, this is the heart 8. And definitely when we are treating this point, we are achieving very good results. But right now, my focus is not the targeting the points, because we are going to discuss in the deeper detail. Right now, our focus just developing the understanding that how the meridian going, from where the meridian is passing. So this is the another point, the heart 8A, heart 8A, right? So in that way, this is just a summary of the points. Now let's see, this is the small intestine meridian. So we can see here, this is the small intestine 1, same like the TCM. And the TCM is the small intestine 2 and this is the small intestine 3. But as per the Dr. Boll, he found some more point like this point small intestine 1A, 1B, 1C like that. So these are the points available in between found by the Dr. Boll. So we are going to discuss them. So in that way, we have found many points like here. Let's summarize quickly. So number one, the outer side meridian is the lymph meridian. Lymph, we are showing by the LY. The outer side meridian is the lymph meridian. Then the inner side meridian, that is lung meridian. So two meridian found in the thumb. Then we are coming to the index finger. So this radial side or the thumb side meridian is the large intestine. It is the same like our TCM. The other side meridian is very useful for the nerve disorder, that is called nerve degeneration meridian. So all the problem of the nerve we are going to treat by using this. Then we are coming to the middle finger. In the middle finger also we are having two meridian. The inner meridian is the same meridian, pericardium meridian, what we are discussing in the TCM. Dr. Bull has given the CI name means circulation meridian. Now if we go to the other side means ulnar side or the small finger side. So if we are going that, that is a very important meridian that is called allergy meridian, and with the help of this, we will able to treat many allergic disorders. So that is called allergy meridian. Then we are coming to the ring finger. In the ring finger, radial side or the thumb side meridian called organ degeneration meridian, we have discussed it is doing very deeper cleansing like we are doing during the Diwali. So deeper level of the cleansing, it is expelling the very deeper levels of toxins and making your body organ youth. So that is called organ degeneration meridian. Now the outer side point, that is triple bomber, it is same like we are discussing in the TCM. Then in the small finger, the same two meridian exactly as per the TCM, heart meridian inside and small intestine meridian outside. So in that way, in the palm, we have seen two meridian in the thumb, two meridian in the index finger, two meridian in the middle finger, two meridian in the ring finger, and two meridian in the small finger. So total we have seen 8 meridian. Okay. So now my question from you. You have to reply quickly. So I will proceed ahead because right now we are talking about the like one group, one home, then we have to enter in the home, like we are talking about the allergy degeneration meridian. Okay, then we have to enter inside the allergy degeneration meridian and we have to discuss the minute thing about that. So quickly write down the name of finger having lymph meridian. Write down the finger quickly. So the people writing index finger, they are really very mahan, great, because it's found in the thumb. How can it found in the index finger? Lymph meridian. Okay. The meridian who is doing very deeper level, the cleansing, organ degeneration meridian found in which finger? Organ degeneration meridian found in the ring finger, not in the thumb. Wonderful. Now tell me, which meridian is found, which the nerve degeneration meridian found in which finger? That is index finger. Wonderful. Okay. Now tell me completed. Lung, lymph, nerve, allergy, organ done. Other meridian, you already know that. Okay. So quickly we go to the feet. Now we are going to the feet. So alert, because I will be asking you, right? Be alert. Let's see the feet. If we talk about the feet, in the feet we are having, we already know this is the spleen meridian. Spleen meridian is the meridian who is going from this medial side, right? This is the location of spleen meridian. The spleen meridian is available in the left feet, only the left feet, not in the right. And the right feet, the same meridian is called pancreas meridian. Pancreas. Okay, so remember one thing. Suppose nowadays there are how many patients having cholesterol problem? Okay, too many patients. So if you want to treat any types of the fat metabolism, you have to treat the pancreas meridian. Pancreas meridian will be treating the fat metabolism. Then you will be thinking how the pancreas will be treating the fat metabolism. Because we have heard that pancreas is for the diabetes or for the sugar metabolism. What is the connection of the pancreas with the fat metabolism? Remember, if your pancreas is weak and if you take the 1 spoon ghee, the same ghee will be coming in your stool, your body will not able to digest it. The liver and pancreas both play a very, very important role to digest the fat. Pancreas is secreting three enzymes. What is the name? Anyone? The name of enzyme is LAT. LAT. The pancreas secreting three enzymes. I'm writing the name of enzyme. LAT. The L is lipase. A means amylase. T means trypsin. These three enzymes secreted by the pancreas, and lipase is digesting the fat, amylase is digesting the carbohydrate, and trypsin is digesting the protein. So pancreas also a very big gland who also responsible for digestion. Not on, do not think pancreas just for the sugar metabolism. So pancreas can be divided in two parts. Number one part who is secreting enzymes, and I told you LAT3 enzyme, lipase, amylase, trypsin. The another function of the pancreas that who is secreting endocrine hormone like insulin. And with the help of that, it will be controlling your sugar. So if there is a disturbance of the fat metabolism, we will be using pancreas meridian, like the cholesterol. If there is a disturbance of the protein metabolism, like suppose in the urine, protein is coming, it's very common. Patient will come to you, doctor, there is a protein in my urine. There is a albumin in my urine. Albumin is the protein. Then you have to treat the pancreas meridian. And definitely, if there is a disturbance of the carbohydrate, like if there is a more glucose in the blood, means your diabetes, then also have to treat the pancreas. So pancreas will not only treating the diabetes, it's treating the, what is sugar? Sugar is a carbohydrate. So pancreas will be treating carbs, if the problem of the carbs, if the problem of the protein, if the problem of the fat. You want to reduce the fat, only 4 points. Wonderful effect. You want to treat the diabetes, sugar metabolism, only 4 point, wonderful effect. And if you want to treat the whether the protein albumin coming in the urine. If there is a more protein coming in the urine, it will create unwanted pressure on the kidney. We know there is a kidney problem, nephritis, nephrotic syndrome. Then when doctor checking the urine, oh, more protein. Protein is plus plus. Protein is plus 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 plus. It means high protein means nephrotic syndrome. Who will treat pancreas? Because pancreas is digesting protein, carbohydrate, and fat. And we are having excellent point without the needle, just by putting the seeds or putting the magnet or electric device which is coming in 800 rupees only. You can treat the cholesterol metabolism, you can balance the protein metabolism. So now regarding the, so this was the pancreas meridian. Then you will be asking, then what is the meaning of spleen? Is there is any role of the spleen? Because pancreas meridian is only on the right side. So now onwards, if you want to treat the cholesterol, treat on the right side. If you want to treat the sugar, treat the right side. If you want to treat the protein, treat the right side. Okay, not the left. Because left side is called spleen meridian, and which is treating the problem of blood, means blood chemistry. What is the problem of the blood? Hemoglobin, WBC. What is blood? Blood is the combination of only two things. Blood is the combination of only two things. Number one, cells. Number two, liquid. Only the two things. So number one, blood cells. Number two, liquid, that is called plasma. So both together are called blood. This is treated by the spleen, which is found on the left side. So the meaning of blood cells: RBC, WBC, platelet. Now what happened? Dengue. What will happen in the dengue? Platelet count reducing. So we have to treat the spleen meridian. RBC count is decreasing in the malaria, because RBC are breaking down in the malaria, even in the dengue. Or someone is having problem with the hemoglobin, problem of the blood chemistry, we will be treating the spleen meridian. So whether the problem WBC, what is WBC? WBC is the policeman of blood. They are all the time, they are rotating, like in our city, in the night, police are moving here and there, doing the survey. So there shouldn't be any criminal activity around. In the same way, WBC all the time moving around in through the blood and looking if the pathogen is entering, if something is happening wrong. So all the problems of the WBC also will be treated by the spleen. Sometimes we see the WBC is very high, sometimes WBC is very low, RBC high, RBC low, platelet high, platelet low. All the things will be treated by the spleen meridian. Then we will be treating them on the which side, right or left? Tell me. Which side, right or left? So we are treating them on the left side. This is the beauty of the Dr. Voll. Dr. Voll has done a great research. Now see, one person is doing the research, and he has given lots of wonderful things, lots of cream, and just we have to learn that and have to apply. These all protocols are very proven protocol, and there is no like experimental things. All the protocols are very proven. Just you apply and you will be achieving the results. So in this way, this is the spleen meridian. Now on the other side, this is the liver meridian. As per the Dr. Voll has given a wonderful explanation of the liver meridian, but we already know the liver. So right now I am just showing the route. This is the same liver meridian as given in the TCM. So let's move to the index toe. Now we are moving to the index toe. This is the index toe. In the index toe, we have already our stomach meridian. Stomach meridian is passing from this side, and we already knowing that. We are discussing in the TCM. And so we know this is the stomach 45, this is the stomach 44, this is the stomach 43. But Dr. Voll has done given some more points in between. So on the one side, we are having stomach meridian in the index toe, but as per the Dr. Voll, index toe is the very wonderful toe. All the joints problem we can treat with the index toe only. So on the inner side, on the thumb side, this meridian is called joint degeneration meridian. And with the help of this, we will able to treat the problem of the joints, right? We know what is the joint, the meaning of joint, knee joint, the meaning of joint, ankle joint, the meaning of joint, hip joint, elbow joint, shoulder joint, wrist joint, the joint of the fingers, even the joint of the spine. Suppose someone is having the problem of the L4, L5 vertebra. This is also the joint between two vertebra. So each and every joint, the problem of the spine, these all things will be treated by this JD meridian or the joint degeneration meridian, and we will be learning that. So we have done, now we are moving to the middle toe, right? So today one lady came to my clinic. She was having some fibroid. She was having fibroid in the uterus and also lump in the breast. Okay. I was just checking, I was just doing checking with this device. As soon as I kept the point on the fibroid meridian, the device was showing something like what I will show you. But right now, what I want to tell you, if the person is suffering with the problem of breast lump, if or the fibroid, then the fibroid meridian will be alarming. It will give you full alarm. So this is the fibroid meridian. The meaning of fibroid meridian, whether the fibroid in the uterus or breast in the lump, we will able to treat with the help of this fibroid meridian, which is available in the middle toe. This is the wonderful line of the fibroid meridian. Any female having any problem in the breast, like in the form of nodule or lump or the cyst, or any female having any problem in the ovary or the uterus in the form of cyst, like the ovarian cyst or the uterine fibroid, just you touch this point, she will be having great pain. And by treating this point, you will able to achieve the good results, right? So on the one side, we have fibroid degeneration meridian. Fibroid degeneration meridian will be treating all the lumps, nodule, fibroid, unwanted growth. Okay. On the other side of the middle toe is really very wonderful toe. On the other side of the middle toe, this is the skin or the scar or the skin. So whether this is the question of external skin or the internal skin, with the help of this, we are going to treat. Suppose someone is having pigmentation. Someone is suffering with some scar somewhere. Scar is a very big problem. Like I will give you one example of a scar. You know, urethral stricture. Anyone is knowing that is urethral stricture? Anyone? So what is happening? Person is not able to urinate. Why? Because contraction inside the urethra. It's a very challenging problem. So what is happening? Suppose I am getting injury here, right? I am getting injury here anywhere in the body. Then our body is healing this. Okay. So if I am getting injury here, body will be healing this. And suppose someone is doing some boxing, some practicing, doing some gymming. So that part will becoming a little thick. Okay. Because body is doing healing process in the same way. Suppose this is a pipe. Suppose this is the pipe. There's a urinary pipe. Urine is coming from inside. And sometime little bit injury. Then body healing that part and making the scar. Then person is not able to urinate. Okay. So person is not able to urinate, then going to the doctor, then doctor doing scraping. And again scar, again scraping, again scar, again scraping. It's a very challenging problem. So this is the one example. A scar can give you a great problem. So as per the skin as with the help of this meridian, we can treat the problems of the scar like the urethral structure. Okay, so this is the skin degeneration meridian, and there are many more things we can treat with the help of this, like the problem of the skin, unwanted growth over the skin, we can treat with the help of this. Now let's move to the ring toe. If we are moving to the ring toe, in the ring toe we are having fatty degeneration meridian inside, right? And the outside we are having traditionally that gallbladder meridian. The gallbladder meridian we are already knowing, but inside we are having fatty degeneration meridian. We are going to discuss, like we want to treat the fatty liver, we want to treat the fatty pancreas, we want to treat the unwanted problem of the fat, we will able to treat with the fatty degeneration meridian. So we'll be having discussion of that. And the outer side we are having gallbladder meridian. Now let's move to the last toe or the small toe. On the inside we have kidney meridian. In the Dr. Bowl, the Dr. Bowl started the kidney meridian from the inside, and the outside we are having a regular urinary bladder meridian. Right? In that way, this was a quick discussion. I was thinking to discuss a little more, but time is over. So there are lots of points. Okay, we have to discuss. Even I was thinking to discuss diabetes, but time is over. So no problem. We'll be discussing diabetes tomorrow. Okay. So enough for today. Now tomorrow will meet on the Sunday, and we are having discussion of diabetes. How can we treat the diabetes successfully just by using few points? So enough for today. Let's do the break of 5 minutes and start the session in Hindi. 5 मिनट का ब्रेक करते हैं, फिर हिंदी में सेशन स्टार्ट